All right, hello everyone. My name is Dr. Kearns-Cooper, and you will be listening to a video lecture this evening that's going to help to introduce you to our course, which is Trauma and Resiliency. And first, let me apologize. Unfortunately, I am dealing with uh, the flu, in which I'm kind of been set back and having a relapse. Therefore, what I was hoping to do was meet with you for a little while this evening. However, unfortunately, I will not be able to. I have to kind of maintain strength and it wanes quickly. So I'm going to briefly go through these slides and just give you an overview of what to be looking for. And I will be also providing you with not only readings from your textbook, but also provide you with some links and some information for you to be able to use to kind of understand what we're talking about. So with that being the case, again, this is going to be uh, a course that we will tackle ways of how to counsel and help people start healing from experiencing trauma and letting them know that they can do it. So, to start off with, you'll find in your textbook that it's going to be discussing and talking about trauma resiliency model as well as the community resiliency model. And I'm going to be going deeper into it throughout the semester. But for tonight, I wanted to just make sure you kind of had a running definition and operation for these terms. And then as you're reading, it'll kind of all click into place. So I'll ask you to bear with me as I go along in explaining some of these terms, okay? So what is trauma resiliency model? Or I'm going to, from at this point, start saying TRM. Think of this as a mind-body toolkit that we use to help a person heal from trauma. However, instead of only focusing on talking about what happened, TRM helps teach people how to use, excuse me, their body's natural abilities to feel safer as well as more balanced. It's built on the idea that trauma reactions are going to be normal biological responses and not just signs of weakness or mental illness. Now, the way it works is pretty much we get clients to understand how their body, the biological processes, can actually help with the healing processes. That being, we help them to learn a little bit more about the autonomic nervous system, in which that's responsible, of course, of fight or flight or even freeze. So there we show them these different tools within their own bodies so that they understand how they might get stuck after a severe stressful situation or a traumatic event. Now, what happens is things like smell, sound, or sight actually can suddenly make a person feel like the trauma is happening all over again. Might be having flashbacks. These are symptoms that you can find within post-traumatic stress disorder. You might have some type of adjustment disorders that they might be dealing with. And we're going to go into that throughout the semester. But just to give you an idea, our goal is to try to help make them feel safe during this time. And the TRM model will help to teach them how to gently calm those body responses and bring them back into the here and now, that present moment. Now, within the TRM, there's 9 skill sets that you would help them learn. And out of 9, 6 is actually shared with the community resiliency model. So I'm going to talk about those as well. But right now, just to give you a really brief synopsis about community resiliency model or CRM, here, this is for that everyday self-care. And more or less, it's dealing with these 6 areas. First, we talk about tracking. We'll talk about resourcing. We're going to talk about grounding, how we might utilize gesturing, a help now action, and then, of course, shift and stay. And like I said, there's several more slides. It's going to break this down further, but I wanted you to know that these are those 6 skills that you'll find within both models that allows us to help a person build their confidence and help them to begin managing that overwhelming emotion they might experience and understand the body sensations that's triggered because of these traumatic reminders. So we're going to go deep into this and we're going to see how to utilize trauma reprocessing skills. And above all, once we're finished with all of these, hopefully we'll have a person being able to get back on track to healing. Now, before I go further into the next set of slides, I just want to say that if there's any questions that come up after you've watched this video lecture, please do not hesitate. Send me a message. You can send it through Moodle. You can send me an email, whichever way, and I'll be happy to try to get a response to you. My hope is that by next Thursday, we'll be back on track. We'll be able to meet each other live in person. And actually, excuse me, although this is not the opportune way for us to introduce, it will allow you to get caught up with reading so that when we do meet next week, we already have a plethora of information and a plethora of material to start working from. So, got to always keep a positive framework when you're working in this field. Uh, with that note, let's move on.
To help with the lecture, I had to employ AI to help as I have now lost my voice again. Please bear with me. So here is a breakdown of the 6 skills of both TRM and CRM explained. First, we have tracking, mindfulness of the body. Tracking is the practice of noticing sensations in the body without judgment. It's about paying attention to signals like warmth, tension, tingling, or relaxation. By tuning into their body, individuals learn to recognize when their nervous system is stressed versus when it is calm. This fosters self-awareness and helps individuals recognize shifts toward resilience. The second skill is resourcing, ways to feel safe and supported. Resourcing involves identifying and recalling people, places, activities, or memories that bring comfort and a sense of safety. For example, remembering a supportive friend or a peaceful walk by the ocean can activate positive sensations in the body. Resourcing strengthens the nervous system's ability to return to balance and fosters a sense of inner stability. Third, we have grounding. Using your senses, the here and now. Grounding anchors attention in the present moment through sensory awareness, what you see, hear, touch, taste, and smell. For instance, noticing the feel of your feet on the floor or the colors in the room can bring the mind out of distressing memories and into the here and now. This skill interrupts overwhelm and reorients the nervous system. Next is the fourth skill, gesturing, using natural soothing movements. Gesturing utilizes the body's own natural, often unconscious self-soothing movements, such as placing a hand on the heart, stretching, or wrapping oneself in a blanket. When made intentional, these movements reinforce safety and calm. Gesturing shows how the body can signal comfort to the nervous system without needing words. The fifth skill is called Help Now, Strategies for Calmness. Help Now skills are immediate practical tools for regaining balance when distress is strong. Examples include naming objects in the room, counting backwards, or pressing feet firmly into the ground. These strategies are designed for quick use in daily life and can help prevent escalation into panic or shutdown. Then the sixth skill is called Shift and Stay, moving focus from distress to calm. Shift and Stay teaches how to move attention away from uncomfortable sensations toward more pleasant or neutral ones, then stay with the calmer state long enough to let it settle in. For example, shifting focus from tightness in the chest to warmth in the hands. Over time, this builds resilience by training the nervous system to linger in regulation instead of distress. Now, the next 3 skills are specifically geared toward TRM. 1. Titration, revisiting trauma in small bits. Titration means approaching traumatic memories in small, manageable doses rather than diving in all at once. Instead of overwhelming the nervous system, the memory is revisited in tiny sips. By focusing only on a small piece of the experience, clients can process without re traumatizing, slowly building tolerance. An example of this would be to think of it like dipping a toe in the water before gradually wading deeper rather than being thrown into the deep end. 2. Pendulation, moving between distress and calm. Pendulation is the process of gently moving awareness back and forth between painful sensations and calming ones. It mirrors a rocking motion, one moment acknowledging the discomfort, the next moment shifting to a place of safety or neutrality in the body. This teaches clients that their nervous system isn't stuck forever. It can flow between activation and calm. Over time, this helps people develop trust in their body's ability to self-regulate. Imagine a swing moving back and forth. Distress is on one side, calm is on the other, and healing happens in the gentle rhythm between them. 3. Completing survival responses, unfinished fight, flight, or freeze. During trauma, the body often prepares for survival, fight, flight, or freeze, but doesn't get to finish the response. For example, someone may have wanted to run but was trapped, or wanted to push away but couldn't. That incomplete survival energy stays stuck in the nervous system. Again, with TRM, we help clients revisit and complete those responses safely and therapeutically, such as mimicking the pushing movement or imagining running to safety. This allows the body to close the loop, releasing stored tension and restoring balance. It's like finishing an interrupted sentence. Only then can the nervous system move on. So the following concepts align with CRM. Let's start with the you're okay zone, the resilient zone. Think of your body and mind like a car cruising smoothly down the highway. When you're in the resilient zone, sometimes called the you're okay zone, everything feels balanced. Your thoughts are clear, your emotions are steady, life's everyday hassles, traffic, deadlines, minor arguments feel manageable. This is your body's natural rhythm or homeostasis, a steady, balanced flow in your nervous system. In this state, your brain and body are working together the way they're supposed to. But what happens when stress or trauma hits? Your nervous system can get knocked out of that resilient flow, and you may find yourself in one of two other zones. The high zone, hyperarousal. Your sympathetic nervous system kicks in, the system designed for survival. Heart races, muscles tense, thoughts scatter. You may feel anxious, angry, panicked, or like you need to run or fight. It's basically your body saying, danger, act now. The low zone, hypoarousal. Here, the parasympathetic nervous system takes you in the opposite direction. Instead of being revved up, you slow way down. You might feel numb, spaced out, disconnected, or even hopeless. It's your body's way of shutting down to conserve energy when things feel overwhelming. The question we need to ask is, why does the resilient zone matter? Here is some good news. With practice and tools like the Community Resiliency Model (CRM) and Trauma Resiliency Model (TRM) skills, you can learn how to help your client and yourself return to the resilient zone more quickly when stress pushes you out of it. Understand, when you or your client is in the zone, no one is perfect, but you and they are okay, balanced, and able to cope. The goal isn't to never leave it. That's impossible. Life happens. But to notice when you're out and use skills to come back. So overall, the resilient zone is your sweet spot of balance. High zone is like slamming on the gas. Low zone is like stalling out the engine. And the resilient zone is that smooth, steady drive where you feel present, clear, and capable. According to Millicaris, resiliency is the innate capacity of human beings to adapt, recover, and grow stronger in the face of stress, adversity, or trauma. It is not about avoiding hardship, but about the body and mind's ability to return to a balanced state, what she often calls the resilient zone. In this zone, people can think clearly, regulate their emotions, and respond effectively to life's challenges. Core principles of resiliency. Biological foundation. Resiliency is rooted in the nervous system. It involves how the body processes sensations, emotions, and memories. Trauma can throw the nervous system out of balance, but resiliency allows it to recover. Not pathology, but biology. Symptoms of trauma, flashbacks, anxiety, numbness, are reframed as common biological responses rather than mental weaknesses. This shift reduces shame and emphasizes the body's natural wisdom, learnable and trainable. Resiliency is not fixed. It can be strengthened through practice. Skills such as tracking, resourcing, grounding, gesturing, help now, shift and stay, and reprocessing skills, titration, pendulation, completing survival responses, provide individuals with tools to develop resilience actively. Integration of mind and body. Resiliency involves reconnecting thoughts, emotions, and body sensations. This integration helps restore a person's sense of wholeness and agency. Community and shared strength. Resiliency is not just individual, but also collective. By sharing wellness skills across groups and communities, resilience spreads, creating a culture of healing. Outcomes of resiliency. When resilience is cultivated, individuals regain a realistic sense of self instead of seeing themselves as broken. Reduce the power of trauma reminders by staying anchored in the present moment. Experience increased confidence, emotional regulation, and well being. Recognize that healing is possible because the body holds an inherent capacity for repair and recovery. In Miller Karras' words, resiliency is the ability to return to balance after being thrown off by life's challenges, to stay in the resilient zone more often, and to recognize that our bodies hold the key to our healing. Now, according to Miller Karras, neuroplasticity is the brain and nervous system's natural ability to change, adapt, and reorganize itself throughout life. It means that new neural connections can be formed and strengthened when people practice new skills, focus their attention, or have new experiences. Neuroplasticity is the biological foundation of healing in TRM and CRM, showing that trauma does not permanently damage the brain. Instead, the nervous system can learn new patterns of regulation and balance. Core principles of neuroplasticity in TRM CRM. The brain can rewire itself. Even after trauma, the nervous system can build new pathways that support calm, regulation, and resilience. This process helps unstick survival responses that were left incomplete during overwhelming stress. Sensory awareness creates change. Miller Karras emphasizes that focusing on sensations in the body rather than only thoughts can activate neuroplasticity. By tracking and grounding, clients learn to shift from distress to calm, teaching the nervous system new options. Practice strengthens pathways. Just as practicing an instrument builds skill, repeated use of TRM CRM wellness skills strengthens neural networks for resilience. Over time, people spend more time in their resilient zone and less time in high, fight, flight, or low, freeze, numb states. Hope through biology. Neuroplasticity demonstrates that change is always possible. Instead of seeing trauma symptoms as permanent, clients learn their brain and body can recover and grow stronger, a message that restores hope. Why it matters in healing. Clients learn that their reactions are normal biological responses, not signs of weakness. They understand that the nervous system can learn new ways of responding that reduce distress. Practicing resiliency skills literally reshapes the brain, helping people regain a sense of control, well-being, and connection to others. Miller Karras views neuroplasticity as the scientific foundation of resiliency work, explaining why skills such as tracking, resourcing, and grounding can transform the nervous system and support long-term healing. Perspective in regards to resilience is the way individuals interpret and make meaning of their experiences, especially traumatic ones, influencing whether they view themselves as powerless victims or capable survivors. A resilient perspective involves reframing adversity, finding strengths, and recognizing possibilities for growth despite hardship. Perspective in the context of trauma and resilience. Perspective plays a crucial role in how individuals process traumatic events and eventually cultivate resilience. Trauma often narrows one's perspective. Life can feel frozen around the pain, and the world may appear unsafe or unpredictable. Resilience, on the other hand, involves the gradual broadening of perspective, allowing individuals to reinterpret their experiences in ways that foster healing, growth, and even meaning making. Trauma's impact on perspective. When trauma occurs, perspective often shifts toward survival mode. The brain's focus narrows to threat detection, and individuals may view themselves, others, and the world through a lens of danger or distrust. For example, self perspective. A survivor of childhood abuse might internalize the belief, I'm broken or unworthy. World perspective. A person who experienced a violent assault may conclude the world is never safe. Future perspective. After natural disasters, survivors may struggle to imagine a hopeful or stable future, focusing instead on fear of recurrence. This altered perspective is not weakness, it's an adaptive response to overwhelming danger, but left unexamined, it can reinforce hopelessness or maladaptive coping. Resilience as a shift in perspective. Resilience involves reclaiming and reframing perspective. It doesn't erase trauma, but reorients how it is understood and lived with. This shift can happen through therapy, community support, spiritual beliefs, or personal reflection. For instance, reframing the self. A veteran with PTSD may, through treatment, shift from "I am damaged by war" to "I survived something extremely difficult and I have strengths because of it." Reframing the world. Survivors of 9/11, while acknowledging the world's risks, also recognized extraordinary acts of kindness and unity, reshaping their belief in human compassion. Reframing the future. A cancer survivor may adopt the perspective of gratitude, focusing on each day as a chance to live fully rather than a countdown to potential recurrence. Example in practice tomorrow marks the 20th anniversary of Hurricane Katrina, a natural disaster that scarred many people. There are people still dealing with the trauma of that occurrence. So, this particular example may prove useful for someone experiencing trauma from a hurricane. So, consider two people who lost their homes in a hurricane. Person A sees the event as evidence that life is cruel and unpredictable, leading to isolation and despair. Person B acknowledges the pain, but reframes the disaster as an opportunity to rebuild differently, seek community, and advocate for better preparedness. Their perspective fuels resilience, while the other person remains stuck in trauma's constricted lens. The role of perspective taking and healing. Perspective is also shaped by connection. Being able to take the perspective of others, through support groups or therapy, allows trauma survivors to realize, I am not alone in this. At the same time, caregivers who practice perspective taking can offer more empathetic, culturally sensitive support, affirming the survivor's experience while gently guiding them toward broader, more hopeful ways of seeing themselves and the world. As you can see, how one perceives their world, their experiences will either work toward healing or continue to have the trauma escalate, creating an imbalance. As counselors, we must maintain a perspective that leans toward positivity.
So, briefly, let me introduce this section, and as we go forward, we'll learn a little bit more. But when we're talking about defining what intersectionality is, as the little image depicts, we're looking at several different areas that's pretty much coming together, which would be race, gender, class, sexuality. And it's the idea that these will overlap, being that it's combined with our experiences, and it's going to impact and influence those that might deem themselves as privileged, or they might not even see themselves as privileged, or those who consider themselves to be oppressed. So when we're talking about intersectionality, know that we're looking at interconnectedness, particularly within social identities. We look and discuss how it'll impact one's resources, how they would cope with situations, particularly with trauma, and what level of resilience they can find themselves to be in. Third, it helps you to recognize what the trauma would be, and the recovery process that might have to be undertaken, and how it'll influence these overlapping systems that helps to make a person who they are, whatever their cultural identity will be. So just wanted to introduce you to the woman who helped coin the term intersectionality, and that's Kimberly Crenshaw, who was as part of the Black feminist movement. So more or less, she saw this as a necessity because of all the problems between seeing people devalued, seeing discriminatory practices, understanding that there's microaggressions present. She coined this to kind of highlight how these different systems of oppression pushes down an individual and how we have to recognize it in order to help the healing process begin. Now, by trade, she's in law, but again, she is part of the Black feminist movement. So it's for her thought processes we are to be thankful to understand and see the importance of intersectionality. So we're going to leave off here at intersectionality, but I just wanted to point out two additional things that you should know and be aware of. First, intersectionality, it's not going to align with people's analytical systems. It's not supposed to be logical. It's supposed to be where it's organic. It's where we have to look beyond the labels. And it's because of those labels that we actually find stigmas and stereotypes, and because of those, we start to see how the oppressive state develops. So you don't want an analytical system in place when you're talking about intersectionality. But you do want to look at intersectionality in terms of real life scenarios, real life experiences and situations, and how it helps when we're dealing with experiences of people. Here on this slide, you see where it talks about an example of how a Black woman may face those microaggressions I mentioned earlier, um, and both be a racist as a sexist in ways that a white woman or or a Black man wouldn't see it in the same fashion. You'll learn that culturally speaking, we have to make sure we look and be aware of the individual aspects of each person and not clump people together, which unfortunately a lot of people will do, particularly when it's talking about race. Negative connotations may also come to a person of color when they're automatically marginalized and not seen for their full potential. I hope that we'll get deeper into this when we get together next week.
Well, this is the end of our first lecture. However, it's only the beginning of our learning how to look, feel, adapt, and adjust to trauma, and how to build resilience not only for our clients, but for ourselves. Please make sure that you take your attendance this week. There's an attendance page that's in Moodle, as well as an assignment that's going to be due by the time we meet next week. So at that point, what I also ask for you to do is to review the syllabus. And if you have any questions, by all means, we can go over it next week. Again, I want to apologize for not being able to meet face-to-face with you this week. Unfortunately, with the flu, it is a real humdinger. If you understand what that term is, it's taking me for a loop, and it's difficult for me to speak coherently, hence is why I'm using AI, and at least you get to meet my avatar. Once again, if you have any questions, do not hesitate to send them through a message or through my email, and I'll be happy to answer them as quickly as possible. I appreciate your time for listening, and I thank you so much. I can't wait to meet you all next week. Have a blessed weekend. Enjoy the holiday. Peace and blessings.